Adding this drug to his current regimen put this patient at greatest risk of which of the following adverse effects? Look, which drug? Valganciclovir. Okay, let's read. 43-year-old with HIV presents with 2-week history of progressive diarrhea and 3 kg weight loss. During this period, he had 3 to 4 episodes of watery stool daily with multiple intents of blood in the stool. Okay, bloody stool. Is current receiving antiretroviral therapy for with zidovudine, lamivudine, and dolutegravir. Physical examination shows failure in dry mucous membrane. A colonoscopy shows multiple linear ulcers. A PCR confirmed the cytomegalovirus. Okay, this patient developed cytomegalovirus-related colitis. Usually, people develop cytomegalovirus colitis in HIV patient when their CD4 cell count drops below 50. They develop a type of bloody diarrhea. And how we diagnose this one? It's really important. We diagnose the cytomegalovirus-related colitis in HIV patient through colonoscopy and taking biopsy. Through colonoscopy and taking biopsy or checking in PCR. We diagnose in this way. When the treatment is for cytomegalovirus, we give ganciclovir. Okay, valganciclovir is another form of ganciclovir that has more bioavailability, that reaches more the systemic circulation. Okay, when we give valganciclovir for this patient with HIV, who also takes zidovudine, lamivudine, and dolutegravir, what will happen to this patient? Which side effect will happen? Which drug interaction will happen? Okay, among these drugs, zidovudine causes inhibition of DNA replication in HIV. One of the side effects of zidovudine is myelosuppression, pancytopenia. Myelosuppression or pancytopenia. Okay. The side effect of valganciclovir is also pancytopenia, myelosuppression. Okay, because valganciclovir is a guanosine analog and inhibit the viral DNA polymerase. Which virus? Cytomegalovirus. Okay, sometimes it affects the bone marrow and cause pancytopenia, thrombocytopenia, anemia, and leukopenia. That's why if we give valganciclovir with zidovudine, both has the side effect of pancytopenia, then the chance is high here if we give valganciclovir with zidovudine together. The right option is here, pancytopenia. Okay, let's read which other antiviral medication cause these side effects. Okay, which antiviral medication cause hyperglycemia? Indinavir is a protease inhibitor which we use for HIV. It causes hyperglycemia. Abnormal dreams, the medication called efavirenz. That's an NNRTI, non-nucleoside reverse transcriptase inhibitor. It's also used for HIV. This one causes also abnormal dream or hallucination or other neuropsychiatric symptoms. Hepatic steatosis, hepatic damage. There are lots of medication can cause hepatic damage, including antiviral medication. Okay, and pancytopenia. As I said, valganciclovir and also zidovudine. Valganciclovir is used for treatment of cytomegalovirus, zidovudine for HIV. Crystal nephropathy, acyclovir is the medication that inhibits the viral DNA polymerase, especially the varicose zoster virus and also the herpes simplex virus. Is used for treatment of those viruses. It can cause crystalline nephropathy, which is a form of intrinsic kidney damage. Okay, orthostatic hypotension. Orthostatic hypotension is caused by, I think, by amantadine and remantadine, but these medications are not used for treatment of viruses, especially influenza virus. Amantadine and remantadine. I think these two medications cause orthostatic dysregulation, orthostatic hypotension. These things.
Thanks for watching. Please give a thumbs up and subscribe for more.